Welcome to the Dr. Izzy's Medical Podcast channel.
Question: what drug is used to rapidly reverse the blockade and muscle activation caused by non-depolarizing muscle blockers? Answer: neostigmine, an ACHE inhibitor. Question: what drugs are used when treat atypical depression won't respond to typical first-line drugs? Answer: non-selective MAOs. Question: what fusion gene in chronic myeloid leukemia yields the overactive tyrosine kinase receptor seen? Answer: BCR and AB1. Question: what generation antiepileptic is carbamazepine? Answer: first generation. Question: what generation antiepileptic is clonazepam? Answer: first generation. Question: what generation antiepileptic is ethosuximide? Answer: first generation. Question: what generation antiepileptic is phenobarbital? Answer: first generation. Question: what generation antiepileptic is phenytoin? Answer: first generation. Question: what generation antiepileptic is valproic acid? Answer: first generation. Question: what generation cephalosporin and ceftriaxone? Answer: third generation. Question: what generation cephalosporin and cephalexin? Answer: first generation. Question: what generation cephalosporin is cefaclor? Answer: second generation. Question: what generation cephalosporin is cefazolin? Answer: first generation. Question: what generation cephalosporin is cefazolin? Answer: first generation. Question: what generation cephalosporin is cefepime? Answer: fourth generation. Question: what generation cephalosporin is cefepime? Answer: fourth generation. Question: what generation cephalosporin is cefotaxime? Answer: third generation. Question: what generation cephalosporin is cefotaxime? Answer: third generation. Question: what generation cephalosporin is cefetidine? Answer: second generation. Question: what generation cephalosporin is cefoxetine? Answer: second generation. Question: what generation cephalosporin is ceftaroline? Answer: fifth generation. Question: what generation cephalosporin is ceftazidime? Answer: third generation. Question: what generation cephalosporin is cefdiaxidime? Answer: third generation. Question: what generation cephalosporin is ceftriaxone? Answer: third generation. Question: what generation cephalosporin is ceftriaxone? Answer: third generation. Question: what generation cephalosporin is cefuroxime? Answer: second generation. Question: what generation cephalosporin is cefuroxime? Answer: second generation. Question: what generation cephalosporin is cephalexin? Answer: first generation. Question: what generation cephalosporin is cephalexin? Answer: first generation. Question: what generation H1 blocker is chlorpheniramine? Answer: first generation. Question: what generation H1 blocker is dimenhydrinate? Answer: first generation. Question: what generation H1 blocker is diphenhydramine? Answer: first generation. Question: what generation of antipsychotics are atypical antipsychotics? Answer: second generation. Question: what generation of antipsychotics are typical antipsychotics? Answer: first generation. Question: what generation of H1 blocker is cetirizine? Answer: second generation. Question: what generation of H1 blocker is desloratadine? Answer: second generation. Question: what generation of H1 blocker is fexofenadine? Answer: second generation. Question: what generation of H1 blocker is loratadine? Answer: second generation. Question: what generation sulfonylurea is chloropropamide? Answer: first generation. Question: what generation sulfonylurea is glimepiride? Answer: second generation. Question: what generation sulfonylurea is glipizide? Answer: second generation. Question: what generation sulfonylurea is glyburide? Answer: second generation. Question: what generation sulfonylurea is tolbutamide? Answer: first generation. Question: what gastrointestinal complication is associated with aspirin use? Answer: gastric ulceration, upper gastrointestinal bleed with chronic use. Question: what group of bacteria are affected by metronidazole? Answer: anaerobes. Question: what group of drugs are used to treat acute gout? Answer: NSAIDs. Question: what is a common adverse effect of all first-line tuberculosis drugs? Answer: hepatitis hepatotoxicity. Question: what is a common gastrointestinal adverse effect of ezetimibe, cholesterol absorption blocker? Answer: diarrhea. Question: what is a secondary mechanism of action of macrolide antibiotics at the gastrointestinal tract? Answer: stimulation of motilin receptors, thereby causing gastrointestinal tract motility. Question: what is a secondary use of probenecid other than to treat gout? Answer: inhibition of the secretion of penicillin, or other acidic drugs, at the PCT. Question: what is a serious adverse effect associated with ticlopidine known as platelet ADP receptor inhibitor? Answer: neutropenia. Question: what is a serious adverse effect of asparaginase in cancer chemotherapy? Answer: acute pancreatitis. Question: what is a serious adverse effect of bleomycin treatment? Answer: pulmonary fibrosis toxicity. Question: what is a serious adverse effect of clindamycin? Answer: pseudomembranous colitis. Question: what is a serious adverse effect of colchicine? Answer: gastrointestinal toxicity. Question: what is a serious adverse effect of succinylcholine? Answer: malignant hyperthermia. Question: what is a serious adverse effect of vincristine? Answer: neurotoxicity. Question: what is a serious adverse effect and risk of teriparatide? Answer: osteosarcoma. Question: what is a serious side effect of laudanacine, the toxic metabolite of atracurium? Answer: seizures, central nervous system toxicity. Question: what is a serious side effect of niacin administration? Answer: hepatotoxicity. Question: what is a severe adverse effect of irinotecan and topotecan? Answer: severe myelosuppression. Question: what is a significant adverse effect associated with ampicillin? Answer: pseudomembranous colitis. Question: what is a significant adverse effect of cyclosporin? Answer: nephrotoxicity. Question: what is add-back therapy in the treatment of endometriosis? Answer: administration of estrogens progestins when a patient is taking gonadotropin-releasing hormone analogs to prevent bone loss and treat vasomotor symptoms. Question: what is an off period in Parkinson's disease? Answer: a period of increased stiffness, rigidity and the inability to move. Question: what are the two main mechanism of actions of amiodarone? Answer: blockade of potassium channels, blockade of inactivated sodium channels. Question: what is bruxism? Answer: teeth grinding, often seen with elevated 5-HT levels. Question: what group of adverse effects are seen following prednisone and prednisolone treatment? Answer: Cushling-like symptoms, weight gain, central obesity, muscle breakdown, cataracts, acne, osteoporosis, HTN, peptic ulcers, hyperglycemia, psychosis. Question: what is mechanism of action of cyclophosphamide? Answer: formation of carbonium ions with guanine N7. Question: what mechanism of action of etoposide? Answer: causes double-stranded DNA breaks through DNA topoisomerase. Question: what is the first choice antibiotic for whooping cough? Answer: erythromycin. Question: what is the first-line antibiotic for Mycobacterium avium complex infections? Answer: azithromycin. Question: what is the first-line drug in mild, moderate or severe depression? Answer: SSRIs. Question: what is the first-line therapy of Parkinson's disease in younger, early-onset patients? Answer: dopamine agonists. Question: what is the first-line therapy for chronic asthma? Answer: corticosteroids, beclomethasone, fluticasone. Question: what is the second-line antibiotic for tuberculosis? Answer: ciprofloxacin. Question: what is the adverse effect associated with carmustine? Answer: central nervous system toxicity. Question: what is the antiarrhythmic of choice to treat paroxysmal supraventricular tachycardia? Answer: adenosine. Question: what is the antibiotic that is the drug of choice for Legionella? Answer: azithromycin. Question: what is the antibiotic used in penicillin-resistant endocarditis? Answer: vancomycin. Question: what is the anticoagulant of choice for the prevention of stroke in atrial fibrillation patients? Answer: warfarin. Question: what is the anticoagulant of choice to achieve immediate anticoagulation? Answer: heparin. Question: what is the antidote for 5-fluorouracil? Answer: thymidine. Question: what is the antidote for acetaminophen overdose? Answer: N-acetylcysteine, regenerates glutathione. Question: What is the antidote for calcium channel blockers? Answer: B1 adrenergic agonists, or other drugs that increase calcium flux. Question: What is the antidote for cyclophosphamide? Answer: Mesna. Question: What is the antidote to heparin? Answer: protamine sulfate. Question: What is the antidote to methotrexate? Answer: leucovorin folinic acid. Question: What is the bioavailability of a drug administered intravenously? Answer: 100%. Question: What is the bioavailability of digoxin? Answer: 75%. Question: What is the black box warning for natalizumab? Answer: risk of progressive multifocal leukoencephalopathy due to opportunistic JC virus infection. Question: What is the black box warning of propylthiouracil? Answer: hepatotoxicity. Question: What is the black box warning that comes with thiazolidinedionase? Answer: congestive heart failure. Question: What is the cardiotoxicity of tricyclic antidepressants? Answer: arrhythmia. Question: What is the cardiovascular toxicity of adenosine? Answer: cutaneous flushing. Question: What is the cardiovascular toxicity of antipsychotics? Answer: torsade de pointes. Question: What is the cardiovascular toxicity of calcium ion channel blockers? Answer: cutaneous flushing. Question: What is the cardiovascular toxicity of cocaine? Answer: coronary vasospasm. Question: What is the cardiovascular toxicity of daunorubicin and doxorubicin? Answer: dilated cardiomyopathy. Question: What is the cardiovascular toxicity of ergot alkaloids? Answer: coronary vasospasm. Question: What is the cardiovascular toxicity of macrolide antibiotics? Answer: torsade de pointes. Question: What is the cardiovascular toxicity of niacin? Answer: cutaneous flushing. Question: What is the cardiovascular toxicity of sumatriptan? Answer: coronary vasospasm. Question: What is the cardiovascular toxicity of tricyclic antidepressants? Answer: torsade de pointes. Question: What is the cardiovascular toxicity of vancomycin? Answer: cutaneous flushing. Question: What is the chemotoxicity associated with 5-fluorouracil? Answer: myelosuppression. Question: What is the chemotoxicity associated with 6-mercaptopurine? Answer: myelosuppression. Question: What is the chemotoxicity associated with methotrexate? Answer: myelosuppression. Question: What is the clinical use for aminoglycosides? Answer: severe gram-negative rod infections. Question: What is the clinical use for sulfonamide antibiotics? Answer: gram-negative, gram-positive, nocardia, chlamydia. Question: What is the clinical use of acyclovir? Answer: HISFAL and VZV infections. Question: What is the clinical use of ambrisentan? Answer: pulmonary hypertension. Question: What is the clinical use of amphetamine? Answer: TX of ADHD in adults and children. Question: What is the clinical use of atomoxetine? Answer: TX of ADHD in adults and children. Question: What is the clinical use of beta-lactamase-resistant penicillins, nafcillin, oxacillin, dicloxacillin? Answer: Staphylococcus aureus, except for MRSA. Question: What is the clinical use of bosentan? Answer: pulmonary hypertension. Question: What is the clinical use of buspirone? Answer: generalized anxiety disorder. Question: What is the clinical use of busulfan? Answer: chronic myeloid leukemia, ablation of patient's bone marrow before bone marrow transplant.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.